So in the series of pharmacology, we are moving further and taking another topic, which is drug used in vascular disease and tissue ischemia or ischemia. So why we are studies, or why we are taking, so what is the mechanism, indication, contraindication, side effects. So all of that studying are in this video. So before taking a drugs, let's introduce about tissue ischemia or ischemia, a critical medical condition characterized by reduced blood supply to tissue or organ, causing a severe shortage of oxygen and nutrients necessary for cellular metabolism. Common condition: atherosclerosis, ischemic heart disease, cerebral ischemia, or peripheral vascular disease. So let's brief about that. Ischemia occur due to atherosclerosis. What is that? It is like obstructions are occur into the arteries or vessels, or like arterioles, for not passes through the blood into the smoothly into the reach out our heart or different organ. So if there occur, why? If you are not abnormalities, if your hormone, or like not good pattern of your food, or like different any kind of sedentary lifestyle, so all of the things you have to cause atherosclerosis. Ischemic heart disease, it means there is thrombus or embolisms occur into the coronary arteries, and the blood circulation is not reached out into their heart muscles, so it will cause the ischemia of their heart arteries. So it would cause the ischemic heart disease. Next is to be cerebral ischemia. It means it reduce the oxygen or like blood supply into the cerebral or like brain. So in it like angioplasty or angiography, you have to be shown into the some patient into the brain. Why? There is not proper or adequate amount of blood they will reached out into the systemic circulation of their blood. So next is to be peripheral vascular disease. It means the peripheral arteries which is present in our like hand or legs. Why it will occur on the, because there is too much fat accumulation, so the compress the blood vessels. On that time there is a blood pressure is to be high on the all four cases. You have to show the patient the blood pressure is to be high, BP is to be high, and the reduction of the oxygen demand into the different organ. So the peripheral vascular disease, so for all of the mechanism we are studying in brief over there. Next is to be hemostasis. What is the meaning of hemostasis? The body physiological process to stop bleeding involving vascular constriction, platelet plaque formation, or blood coagulation. It means if you have showing any kind of cut or wound, so there is a continuously blood you have been shown releasing into the over the wound or like cut. So there is a mechanism of hemostasis will occur over there to stop the bleeding and agglutination of the blood over the wound. So there is a process. So the steps of hemostasis are vasoconstriction, narrowing of the blood vessels, like vascular spasm over there, and it will cause the platelet plug formation. Primary hemostasis plate adhere to exposed collagen activation. It means the hemostasis will be occur over there due to fibrinogen or fibrin, or like a thrombin to thromboplastin. So it will be present into the blood vessels, and it will be agglutination over their cut or wound, and to not flow over too much exceed into the out of the body, and into the blood vessel over out the body. So the collagen fibers are a cover wrapped over the wound or cut, so it will be preserve the blood or arteries over there. So the coagulation cascade or secondary hemostasis now occur, and the healed of the wound you have been shown, and all inflammatory sign will be occur into the secondary hemostasis. So drugs and their action: the preventing of clot formation like heparin or warfarin and dissolving clot. So the if this medicine are used for the blood thinner, it means it will be thinning the blood, or like easily pass out to the vessels. So all of the scenario we are asking about the wound and to the cut outside the body, but in this pharmacology we are studying inside the body, or inside the body of the vessels or like arteries. So any kind of obstructions over there, so it will be any kind of constriction due to the plate or like atherosclerosis formation into the arteries or veins. On that time you are taking the heparin or like where warfarin, it will be thinning the blood vessels, like break down the plaque formation into the blood and artery, and easily pass out blood into the systemic circulation and reached out the different organ into the body. Next is to be lipid lowering agent. What is that? The medication designed to treat dyslipidemia by reducing elevated cholesterol and triglyceride level. It means the sedentary lifestyle. Now everybody have to be shown into the per person. Now, if patient have to become in your clinic and there's shown too much lipid fat and like obese patient, so the blood report you have to be shown the high LDL or like cholesterol level into the patient, so there is a chance to increase like blood pressure or like BP abnormalities onto the patient. So on that time, the triglyceride level is also high and blood cholesterol is also high. So there is two example of medicine like atorvastatin or rizovastatin. There is two medication that will be like inhibit HMG coagulation A enzyme and reductase the cholesterol disease. It means the atorvastatin have like 3 hydroxy 3 methyl butol, so it will be break down the HMG coenzyme A. Like coenzyme A is like a enzyme, there is a bind into the blood vessel and it is to break the plaque formation or atherosclerosis formation into the blood arteries, and it will be like a like reductase. It means reduce the plaque or atherosclerosis formation into the blood or arteries, and decrease the cholesterol level into the blood. And you have to also on the mechanism of the like lipid lowering agent, which is increase the LDL low density cholesterol receptors and increase the LDL clearance into the blood vessels. So low density lipoprotein and low density lipoprotein by receptors are binding into the blood, circulating into the blood vessel, which is good for our health and which is essential for our energy production into the glycolysis cycle, and increase the LDL clearance. Also, you have to be necessary because there is too much accumulation into the blood and arteries. So like after some year you have to install the plaque formation into the arteries. So regular exercise, regular checkups, and maintain your regular healthy life, so it will be necessary for them. So what is the effect you have to shown if you are taking the lipid lowering agents, which is medication are atorvastatin and rizovastatin? So effect is decrease the LDL like low density lipoprotein measure and decrease the triglyceride, which is lipoprotein, which is bad lipoprotein, which is accumulated into the blood, and increase the high density lipoprotein, which is slightly like good for our health. For adverse effect, and if you are taking long term this medicine, there is some like bad or side effects to have to be shown into the body like myopathies, like muscle pain, and hepatotoxicity, like hepatic like our liver or toxicity, because there is a first pass metabolism you have been shown into the liver, and there is too much accumulation into the atorvastatin medicine into the liver, so you have to be shown the toxicity occur into the liver. Next is to be rhabdomyolysis. It means there is some condition into the occur into the body. There is too much like severe dizziness or nausea. There is happening shown into the body. Next is to be antithrombotic drugs. So like brief about it. What is the antithrombotic? Antithrombotic, the like clotting of the blood, or like it will be reducing the clot formation like anticoagulants and antiplatelets. It will be occur if the too much like coagulation or like platelet will be have to be shown into the body, so it will be cause various so the antithrombotic drugs, before going these drugs, the myopathy, hypotoxicity, and rhombodomyolysis, you have been shown into the lipid lowering agent. So antithrombotic drugs. So let's introduce about brief what is antithrombotic drugs. It is a drug. It will like like prevent or resist the coagulation or like platelet adhesion into the organ or cell. So the medication that prevents or treat a dangerous blood clots by reducing the clot formation. So if any kind of like thrombus or like embolism, plaque formation, or like atherosclerosis which is occur in our blood vessels, so it will like break down them, and the flowing of the blood vessel into the systemic circulation, it will ease them. So there is two types of anticoagulants or antiplatelets. The example of anticoagulants is warfarin or episaban. Episaban or warfarin are the slow clotting agent which is used to deep vein thrombosis. So what is deep vein thrombosis? If take example a security guard which is a long time standing without doing any kind of exercise and like sedentary lifestyle. So there is a chance to have a deep vein thrombosis into their lower limb. How the mechanism of deep vein thrombosis? There is a calf muscle which is not pumping, which is secondary heart, which is not pumping their, because there is like a weakness of there. So the downward attraction of the gravity of the blood vessel is to be showing too much. And if there is any kind of condition of like coagulation into the blood, so there is have to be shown agglutination over there into the blood into the lower limb. So the agglutination will occur. So the web kind of network you have to be shown into the like calf muscle. So that is the deep vein thrombosis. So on that time, our friend is a medication to decrease the clotting over there. So pulmonary embolism and arterial fibrillation, you have to be shown onto the blood vessel. So pulmonary embolism, it means the agglutination are like moving into the systemic circulation of the body. Next is to be antiplatelets. So antiplatelets are aspirin or clidoparagel, which is prevent the platelets clumping into the blood vessels. Like myocardial infarction prevention, it means any kind of shock condition which is like not going to the like blood into the brain, or because any kind of obstruction or plague or like lipid or like triglyceride which is agglutinate or like adhere into the blood vessels. So there is a patient had to be caused in shock and myocardial infarction, you have to be shown on that patient. So there is a kind of like paralysis kind of patient, or like quadriplegia hemiplegia, you have to be shown the patient on the condition. So there is a medication like aspirin or clopidogrel, which medicine is used to treat them. So that is the antithrombotic drug. Next is to be thrombolytic, like fibrinolytics. What is the thrombolytics? The are emergency clot boosting medication that restore blood flow by activating plasmiogenesis into the plasmium. Example is to be streptokinase alphase. Mechanism of their thrombolytic is convert plasmogen into the plasma and dissolve fibrin into the clot. So acute myocardial infarction (MI), which is like ischemic stroke. In early stage, you have to even take the streptokinase medicine on the patient. It will be decrease them the like any kind of clot or agglutination into the blood vessels, into the thrombus, thrombolytics, plaque formation into the arteries of blood. So you have to get the medicine on the patient. So that is the end of the cardiovascular pharmacology. Thank you.